Automatic audible alarm systems can provide very important help to the anesthetist. However, too much beeping and uncontrollable alarms may be destructive. The Mindray Veta 5 is an animal-specific anesthesia machine and ventilator. Hence, the monitoring and alarm systems are adjusted for veterinary needs. Nevertheless, a good understanding of the alarm system is important because custom adjustments may be necessary if the patient behaves unexpectedly or something is different from the average patient. In this video, I would like to explain two kinds of false alarms that veterinarians may often experience with this system. If your patient has a strong respiratory drive, it won't need much support or any support at all from the Veta 5 ventilator. In such case, the peak inspiratory pressure remains low, this value here. In order, currently it's not the case. I'm talking about a hypothetical case when this number would be 2, for example. Because the default alarm limits for the peak inspiratory pressure are, for this body weight, are ranging from 4 to 22. If the peak inspiratory pressure is 2, it's lower than the default lower alarm limit. Hence, a low pressure alarm would sound. In this case, let's start with the diagnosis. Is the tidal volume, the respiratory rate, and the end tidal CO2 normal? If yes, consider it a false alarm. And the best course of action is to reduce the alarm limit for the peak inspiratory pressure and reduce the lower alarm limit. The default was 4, let's reduce it to 1, okay. And now the new alarm limits range from 1 to 22. So if the peak inspiratory pressure would be 2 for an animal which has a strong respiratory drive, then with this alarm limit settings, there would be no false alarm. Another way to deal with the same problem would be to convert to spontaneous ventilation. If an animal is breathing with such a strong respiratory drive, it doesn't necessarily need mechanical ventilation, so it's perfectly okay to continue the case with spontaneous ventilation. In another case, you may find that tidal volume is normal, but end tidal CO2 is somewhat low and the respiratory rate is way too high. This may be a sign that either the anesthetic level is not deep enough or analgesia is insufficient. Examine the patient and treat accordingly. If analgesia was a problem, give fentanyl or another analgesic. If anesthetic depth was light, give propofol or another intravenous anesthetic and then increase the vaporizal dial setting. Another common false alarm is that the minute volume is too large or too low. The reason for this lies in the default alarm limit settings. The current default setting does not consider the size of the patient but uses a very large range from 0.2 to 6 liters per minute. With this setting, the minute volume alarm will not be specific to your individual patient. If we consider the normal tidal volume ranging from 10 to 15 milliliter per kilo and the normal respiratory rate ranging from 10 to 15 breaths per minute, then the normal minute volume would range from 0.1 to 0.2 liter per kilogram per minute. Therefore, for a 1 kilo cat, 0.1 liter per minute volume is acceptable, but an alarm would sound because it is lower than 0.2, which is the predefined alarm limit. Similarly, a 40 kilogram dog may have a normal minute volume of 8 liters per minute, but it is higher than the current alarm limit, hence an alarm will sound. In such situation, examine your patient first and make your diagnosis whether ventilation is acceptable. If it is, just go ahead and disable this alarm by adjusting the limits accordingly. I increased the upper alarm limit for the minute volume, and now we increase the lower alarm limit. And we are done. As a side note, I personally do not put much emphasis on monitoring the minute volume of my ventilated patients. I make sure that the tidal volume, the respiratory rate, and the end-tidal CO2 are all normal and that the PEEP is acceptable. If these values are okay, monitoring minute volume is not so important. Nevertheless, minute volume is the product of respiratory rate multiplied by the tidal volume. My name is Dr. Tamás Ambriskó and I'm a veterinary anesthesiologist. Thank you for watching.